Good afternoon. Hope everyone's having a good day today. I do want to bring you up to date on some numbers here. As you know, from last night around 7 o'clock, I did announce that we do have one confirmed case in Dade County, and as we speak, that's all we do have. Thank goodness. Today, we had a conversation with the family. They are going strictly by the guidelines that they're self-quarantined in their home, which that's what you're supposed to do, and they're following everything right down to the T of what they're supposed to be doing. Alex, he can touch on that a little more when he comes up here. He'll give you a little more update there. In Georgia, had quite an increase on confirmed cases. In 24-hour period, it went from 2,809 as of yesterday, and we're at 3,817. That's 1,008 confirmed cases in 24 hours. We had 21 deaths in 24 hours. That's yesterday was 87. We're 108 today, and that's in the whole state of Georgia. We had 129 in Bartow County, 16 in Gordon, 33 in Floyd. These were confirmed cases. 10 in Whitfield, 3 in Chattooga, 3 in Catoosa, and of course our 1 in Dade. Tennessee, we had 1,834 confirmed cases as of today. That's up from 1,537 from yesterday. 40 in Hamilton, 6 in Marion, 2 in Grundy County, and 9 in Bradley. Alabama has 952 confirmed cases. That's up from 837 yesterday. 7 in Jackson, 4 in DeKalb. Nationally, we have a total of 140,904 cases with 2,405 deaths. Okay, I've had a lot of calls pertaining to Cloudland Canyon. I did mention that last night. I think I went over a letter that the governor had issued, and which was controlling the traffic as far as 150 cars and sending the game and fish in to actually help with the enforcement of that. But we are, I want you to know, we are looking into having Robin, our attorney, looking into anything over and beyond that we can do as a county by law as far as shutting down the park, or at least partially shutting down the park. We've got, their state government, our state government. Normally we cannot override any state law, but this is an emergency. We've declared it a state of emergency or a county of emergency. So some things may be a little different, but we'll sure keep you informed between now and the weekend, because the weekend seems to be when everything's happening from Friday on into Sunday. And we're doing everything we can within the law, and we will do everything within the law that we can to control that. People have mentioned, several calls, well, we need to shut the county down. Well, that's easier said than done, and it one day, hopefully it don't, but it may come down to that. But you're talking, if you shut the county lines and the borders down, we've got an interstate highway that runs through Dade County, and our state roads and our county roads, but you would almost have to go into a martial law type thing to do that. So that's not something right now that's happening or going to happen anytime soon here in the county. There may be some other drastic measures we take other than that if it comes down to it. But we're on this, and we're just bear with us on it. Let me see if there's anything here that I need to really bring out other than just try to practice the cleanliness of washing your hands. When you get gas, try to actually use the wipes, disinfectant wipes, especially in your grocery stores. Do that. I mean, it's just we've got to do our part, and I feel that Dade County is doing a really good job of doing our part, but we've got to keep doing that. And as I said, we do have a confirmed case in Dade County, but just don't let that get you down, because we're, as y'all know, we're tough. Dade County, we've got some really good people here, and they're tough, and they know how to survive this, and we're going to get through it. Just don't let it get you down. But just there again, though, don't be so hard-headed that you don't follow directions, because I know a lot of, and I'm one of them, but there's a lot of hard-headed people in this county that really don't like to follow directions. And but this is real, and it's here with us, and we're gonna get through this. So just bear with us. I have a young lady here from the school system that's going to give us a report. Miss Jan Harris, Dr. Jan Harris, if you want to come up and tell us what you've got on your mind. And then we've got several people to speak today, so we're going to move right along.
Thank you, Mr. Rumley. 28,624. 28,624. That's the number of meals that Dade County School Nutrition Program has provided for our sweet children in Dade County. Tomorrow is another meal distribution day, so I want to remind everyone that we'll be running the buses about 4 hours later than normal, and parents can go by Dade Elementary or Davis Elementary between the hours of 10 a.m. and 1 p.m. to pick up the lunches. Now, there's one thing different about tomorrow than what we've been doing so far, and that is we want to practice more safety, keeping our social distancing when we're delivering those meals. So what we want you to do on the bus route, we're asking you to put a newspaper out, put a box out, put your child's wagon out, and stay in the driveway or on the porch where we can see how many children, and then we will put those meals down for you instead of handing those to the children, which is what we've been doing. And so, again, we're asking everyone to help us to keep everyone safe by, incorporating that social distancing by having a receptacle tomorrow at your home, just a newspaper, a piece of fabric, a box, a wagon. We're going to put the meal down in that receptacle, and then if you'll stand outside on the porch in the driveway so that we know you're there like we've been doing, we will deliver those meals. If you come through the drive-through, we don't want you to roll down the window, and we're not going to hand you the food. We want you to pop your trunk or unlock the door, and we'll put the food in the back seat. So that's a little different for tomorrow. The second thing is I want to let the parents know that we are going to have a survey going out today to our parents, and I'm going to share this with everyone. I've received a number of texts, emails, phone calls from our parents, and there's a lot of stress going on with this homeschooling. And you may chuckle when I read this to you, but it's really a true sentiment, and I think a lot of people can relate to this. This parent wrote me, and she said, homeschooling is a no-go for my family. She said, I am not a teacher. And she said, I love you, and I pray you are well and your family stays well, but I cannot live in this chaos from homeschooling. No, ma'am. And she said, pray like you've never prayed before, because I may run away and not come back. And so anyway, we've been talking to this parent, and we're working through the stresses of digital learning. So be sure you fill out that survey, and we're going to edit our plans to meet the needs of our parents, to support our parents, and to encourage and support learning for our young people, because it's the morally right thing to do, whether we have grades, school, or whatever. Children need to learn how to read and write and do arithmetic and be able to function in the world. So we're going to figure all this out. Next week is spring break, and Dade First has worked up a plan for delivering the meals, and I don't want to take up too much time, Mr. Rumley, but I wanted to share with everyone that next week for spring break, you can pick up meals, and I'll be sending this out, and I'm sure Evan Stone will be sending it out in the other media outlets, April 6th and April 8th from 3 to 6 p.m. at the high school. And so there's a number of churches helping with this, and the library, Dade First, Family Connection, Lookout Mountain Community Services, New Salem Baptist, Rising Fawn Baptist, Trenton Ministry Center, Trenton United Methodist, and Tri-State Food Bank. So next week is spring break. We're going to be shut down, but we will have the meal distribution on Tuesday and Thursday, and we'll be posting that again, reminding you a little closer to time. The last thing, Mr. Rumley, as the educator on site, by the authority vested in me, I declare that Mr. Rumley and Mayor Case get an A+ on their communication skills, and I want to thank you for your leadership, and thank you for keeping us safe and for keeping us informed, and Sheriff Cross and Chief Smith and all of our officials. God bless you. Thank you. And again, you get an A+ to both of you gentlemen. Thank you so much.
Good afternoon. Thank you, Dr. Harris. And again, it's a tremendous team effort from everyone in Dade County, from public safety, city and county governments, all the workforces, the school system, our local health department, state public health, and everything that goes on, and you, the community, because we're asking a lot of you, the community and the business owners, to help us with this. We reported last night, again, of that one case, and that's all we knew, that it was a case. Through different folks, I guess us also being the EMS folks, we were notified. We knew where it was and what it was, and making sure our first responders and medical folks were okay. They're watching their symptoms. We did make contact with a friend of the family, called us, and they were okay for us to call them. We had good contact with them. We encouraged them. We're praying for that family and for their recovery. And everyone that's affected with this, that's something we need to think about, is tremendous stress on all of us here, even the people in the county, and a lot of people know who this may be, but that's not for us to say and do. That's for us just to continue our thoughts and prayers for those folks and continue these efforts to help this. The CDC has wonderful information that the infectious control from the hospital through the district state office, not our local public health folks, but their district infectious control folks are working with these families and infected in all the states, especially for Georgia. In this district 1-1 or district 1-1 and 1-2 of all the counties, that's what that group does. They're very limited. The cases that you see and that Mr. Roman gives, that's limited people that's taking care of them, but they will educate these people. These folks are already isolating in place and thinking of people that may have been in contact with them, and call them and let them know that is their responsibility, and we appreciate that. Again, wonderful information on CDC. If you know someone that's sick or been in contact with someone that's sick, follow these guidelines. Watch yourself. Look for these signs and symptoms. Again, allergy season, all the beautiful weekend we had with people out, pollen falling like crazy. We got a lot of it washed off from the rain, but again, now we're getting back cool. We're going to be back cool again. So rain, hot, cold, common cold. Please watch your symptoms, monitor yourself. Every effort through the hospital, through local public health, state public health, is every effort to help these folks. Our emergency services as well, every day we're asking these questions as people call in. Certain calls come in as could be something not even related with a sickness that fell into something like that. So we've made some decisions with our health director, our EMS provider, which is Puckett EMS and Dade EMS, to start asking questions on any medical call we go on, because we never know. Folks are using personal protective gear as they get out there, and that's what keeps healthcare continually going. So again, we're working with this, and also this morning we had the declaration we talked about yesterday, and then we had a meeting today with that group where we have filed an application for public assistance for the county, city, of all of our efforts to do this, because we are incurring costs of extra supplies, things to mitigate this. and hopefully mitigate the future of this and how long this goes. It's something new for the federal government of FEMA. We've been through several declarations in my 15 years here, and even today there was 500 applicants on this call throughout the state, several people from several agencies listening, and it's something new for all of us. So FEMA's given the best guidelines they can to us, and that's things that we will try to recuperate up to 75% or 100% of our costs to help keep our community safe. So again, thank you, community. Thank you for everyone that's out here working and doing for this, and again, it's a great team effort from all of us here. Thank you.
Hi there. I am Tammy Franklin, the nurse manager at the health department. And I just wanted to kind of just, tack on to what they've said. We do have one confirmed case. Like they said, names will never be shared. But I want to tell you the process of what happens once there's a confirmed case. With public health, there's always been a notifiable disease list that doctors, hospitals, everybody around us has this list, and they know diseases that are notifiable to the state. So COVID-19 has been added, and there's different categories, and it is one that has to be notified immediately. There's some that you can wait a little while to notify the state, but this is an immediate notification. So the process is the doctor or whoever has tested this person would call the state epidemiologist and report it. And then in the state, that epidemiologist would actually call the district from where this person is from. We have a 10-county district, and our epidemiologists are in Rome, and we have, 4 maybe, and at this point they're totally overwhelmed. I know they pulled some of the public health nurses in to help them make a lot of the calls. But what they do, they will try to talk to the person that's the case. They will find the contacts to this person. And a contact, this is where it gets kind of wild at times. A contact is a person that's been in contact with the sick person, not a person that knows the person or the person that, has been in contact with the first cousin of the person. I mean, it has to be a close contact. That's who they're going to look for right now. And they will make phone calls to them. And like I said, they're delayed at this point because they're covering lots of cases. So what they're going to tell them is, stay home, isolate yourself. And one difference that they will do in their homes, we're all supposed to be staying home, but they're going to ask them, even from other family members, kind of stay away from them. Don't be in the room with all the kids and whoever lives in your household. Try to keep yourself away from them. They're going to ask you to monitor probably twice a day. That's one of the first signs of this, is temperature going up. And they're saying a temp above 100.4 is, when they call it a temperature. But I know with a lot of these cases, they're having really high temps. So 102, 103. So really, they want them to monitor those temperatures. The cough, that's a very classic symptom of this. And it's usually like a dry cough, and it just makes them really short of breath when they have this cough. So that's the things that these contacts will be monitoring. So they have to self-quarantine, and they're saying about 14 days from when they came in contact with the person that is the case. And if they have any of these signs, they need to call their doctor. And don't just show up at a doctor, don't show up at an emergency room, call their doctor first. And if they don't have a doctor, they can call the hotline. And I think Harry has that listed at the bottom of this video. I know it's been listed. And if not, it's 844-442-2681. That's to report any symptoms you may have that you think it's positive for COVID-19. And Ted always shares the daily status report. And I don't know if y'all have gone on there to look at that, but it does break that down into who actually has the cases, male, female, the age group. And in Georgia, I want to say it's 19 to 59, there's still a higher rate than the older ones that are over 59 that are getting this. So, just be careful. And, I just want to go back to the basics. We need to wash our hands. Keep your hands away from your face. This germ cannot move on its own. It has to have a host. The host is a person. So if we keep ourselves away from other people, it will not move around. If you wear gloves, that's okay. And I've seen a lot of people doing this, but your gloves get germs on them too. So if you're not changing them often, or if you're not sanitizing them, then the gloves really aren't helping you. So wash your hands, keep them away from your face. A study was done that says that people touch their face about 24 times in an hour. And that's how the virus is going to get in our body, through our eyes, nose, mouth. So keep your hands away. If you have to, put them in your pocket, do this, whatever you have to do to keep your hands away from your face. Cover your coughs. Let's see, only go out if you need to buy food. If you need to go to the pharmacy, just try to stay home as much as possible. And that doesn't mean in your house. You can get outside. You can walk around your neighborhood. But don't start gathering with your neighbors to start talking about what's going on. You still need to keep that distance of 6 feet. And also, we've had calls about people that are still having to go to work. And jobs at this point should be following these guidelines. So if you still have to go to work, you can follow these guidelines at your job. Try to stay 6 feet away from people. Keep your hands washed. Keep your hands away from your face. And when we tell you to stay at home, we don't want you to go visit family members. We don't want you to invite people over because they're family. They can come into your house. We really want you to stay with the people that you live with. We don't want you, we just want you to stay right there and not share the germs, with other people. Make phone calls, get on Facebook Live. We have so many great technologies that we can do that with. So please just stay in your house. And, people can monitor themselves too. If you think you have a fever, it's the same symptoms, a cough. If you start having any of that, call your doctor. Don't just show up. The little walk-in clinics, call them first. And because you have to have certain symptoms before they will test you, but just make sure you don't just show up at the doctor. I heard today the CDC is continually studying the virus, which, we won't know all about this virus till next year. I don't know. But the two things I heard today was when the people are actually contagious, they don't really know when a person that's positive, when they really started being contagious and how long they're contagious. That's still an ongoing study. And also they're thinking a lot of people do not have symptoms but have this. So, you got to be careful with everybody. We don't know who those people are that have COVID-19 that are showing no symptoms, but they could still be contagious. Like I said, that's an ongoing study, and people can still get sick from that. So what we have to do is do our part. The way this is going to stop or slow down is because of us. It's not going to be because of any government. We have to do our part in this community. So we got to stay smart and then stay safe. Thank you.
Hello again. I'm Chad. I'm the Public Information Officer for the Sheriff's Office. We don't want to get up here and, as the Sheriff's Office, we don't want to get up here and say the same things repeatedly every day. So Captain Bradford, Tommy Bradford, as most of you know him, had a good idea about maybe we could show you. We notice a lot when we go out into the community, especially the grocery stores and things, we see a lot of people wearing gloves. Gloves are a great protection against the virus or pretty much anything like that. But what we see people putting these gloves on, and then they'll walk into the store, they'll be messing with stuff on the shelf, they'll be picking stuff up, touching buggies, all that sort of thing. Well, then as they're doing this, they may touch something. Well, say my mask here that was donated, say my mask has the virus on it. They touch this. Well, that protects their skin, but they lay this down, and then they reach into their purse. They reach into their purse, and anything that is on that glove can now contaminate anything in your purse. And then later you may go home, take your gloves off, and touch what's in your purse. And that kind of defeats the purpose of the gloves to start with. Once you touch something, that whatever you touch, if it's infected or anything like that, it will get on the outside of these gloves. So I'm going to move a little bit closer, and I'm going to show you how to take these gloves off in sort of an aseptic way. All right, so what you're going to do, see my gloves. Is that good? All right, see my gloves. You take these two fingers, you grab the inside of the gloves, and you pull them off. And then you wad this glove up in one hand, you take this finger, you run under the cuff of the glove, and you take them off. Now, you have the gloves off, and you did not contaminate anything. Now, I'm going to show you that one more time because we see a lot of elderly people and things that are wearing these, and we want to make sure that you're doing it right to lessen the risk of infection. So, again, you grab the cuff of the gloves with two fingers, you pull it off, take that glove, wad it up, take this finger, run under the cuff of the glove, pull it off, and now you're not transferring that infection to anything. So, just keep that sort of thing in mind when you're out doing your grocery shopping. Watch cross-contamination when it comes to touching things and then touching your personal items. And also just remember that we've talked a few times this week about the scams. You know, keep an eye out for those. Let your neighbors know, the people that may not see this. And also the grocery and the medication pickup. My information should be in the comments. If you need any of those things and you're in that at-risk group, call us. That's what we're wanting to do that. So again, thank you for listening to this. And if you need anything, info@dadesheriff.com or call the sheriff's office. Thank you.
Evan, you got anything you want to add today? Tommy? We have Tommy Bradford here also today. And I just appreciate everyone, as I said a while ago, working with us and just helping us bear through this. We have a commission meeting Thursday night. It's not going to be a real lengthy meeting, but it's a necessary meeting. We'll be talking about some other things that will probably stiffen our ordinance up and between the commissioners, and so just bear with us on this and try to do, like I said, just try to do what you're recommended to do. There's been a question about non-essential businesses that I'm not sure how the city or is going to address this as far as we go in. We get we do have some businesses that are non-essential that are still open. And we will, I know the commission will address that Thursday night. So we'll be back here at 3 o'clock tomorrow unless something changes, just as it did last night, and we call this meeting here. So just bear with us, and we'll talk to you tomorrow at 3 o'clock. Thank you.